So this is the cover of the report on the harms of Medicare Advantage produced by PNHP this year. And I know the people who worked on this and have great respect for their scholarship. And certainly we have a position. We are for Medicare for all, and we are for, or some form of it, and we are for a public healthcare system, not a totally privatized healthcare system. And one of our big concerns about Medicare Advantage is it is moving, that the corporations that control it and that are profiting from it are doing everything in their power to completely privatize the Medicare system. These are the, let me get my, okay. These are the main authors of this, all with PNHP. But there were people from Just Care USA, the Commonwealth Fund, UC San Francisco, Public Citizen, Center for Medicare Advocacy, who also reviewed this and worked on it. There were dozens of interviews for this study with patients, family members, physicians, and others. This study is based on 36 peer-reviewed, published studies about Medicare Advantage and its effects. I'm going to jump out of the slides, which I got from the Medicare authors, and just give you a little context here. I have a hard time remembering these statistics, and they change each year. But there are 66 million people covered. 66 million people had Medicare in 2023. Of those, 58 million because they were 65 and over, and another 8 million under 65, like I think it was Priscilla Spence's daughter, who have Medicare because they have some form of disability. When you get Social Security disability, after 2 years, you get Medicare. And so that's, there's a number of people who have it before 65 for that reason. In 2023, we, the taxpayers, spent $944 billion on Medicare. Of the people, of those 58 million, well, actually, of all 66 million people on Medicare, 51% are in a private Medicare Advantage plan. And I'm going to probably, instead of saying Medicare Advantage over and over, you'll see me saying MAP or MAP for Medicare Advantage plan. And in PNHP, we say Medicare Advantage is not real Medicare. It's not true Medicare. And the slide at the right, the graphic at the right, shows how the percentage of total Medicare controlled by private companies through Medicare Advantage has steadily risen, and finally in 2023 rose to over half. And there's no question in our mind that Humana, United Healthcare, CVS, Aetna, Cigna, Centene are all determined to completely privatize Medicare, and for good reason, because they're making billions of dollars in profit from it. The paradox of Medicare disadvantage, to me, is that it harmed. We believe that the research we've done and shown in this report shows that Medicare is harming patients. It's harming taxpayers by letting them be bilked for at least 80 billion a year of overpayments to the private corporations, many running Medicare disadvantage. And as I said, their goal is to totally privatize traditional Medicare. So it's bad for patients, bad for our country, aiming to eliminate the option of traditional Medicare. But in some cases, it may be the best choice for an individual patient because they aren't able to afford the supplemental insurance that you need with traditional Medicare. So that, to me, that's a big paradox, and something that we hope we'll have some time to talk about. So I'm now into the slides which summarize the findings of this study. And in some ways, the person that I think of speaking is Dr. Ed Weisbart, who is a family physician in Missouri, who is really kind of a whistleblower who came out of one of the big private insurance companies that control that run Medicare Advantage or control the greatest part of the Medicare Advantage market, and has really campaigned against it based on what he saw, and was one of the leaders in this research. Death rates are double after some cancer surgeries because Medicare Advantage plans have limited panels and don't let patients go wherever they want to go. You can only go to the doctors in our network. 7.3 million people in Medicare Advantage are underinsured. In other words, the plan they have doesn't cover everything they need, so they wind up with high out-of-pocket costs that cause them to avoid and delay needed care. Even though they have Medicare, they have their Medicare Advantage. Still, things come up, especially denials by the Medicare Advantage company that cause their care to be delayed. 11.7 million people are in a narrow network, and what a narrow network means is that most of the physicians in your county aren't in your network. So you either can't go to see them or you're going to have to pay more. And up to 20 million hours per year are wasted by physicians and other practices trying to get prior authorizations for Medicare. And this is just with Medicare Advantage. And this is a big talking point when we're talking to physicians, because they know how much time their staff has to spend getting MRIs, CT scans, elective surgeries, unnecessary surgeries approved and initially denied. And then you have to get on the phone and argue with them. And finally, they'll say yes, but you've wasted a long time to get something that ordinarily would have been automatically, that is part of the traditional Medicare benefits package. So prior authorizations, narrow networks, underinsurance, deaths, and these all relate to each other. Traditional Medicare is simple, efficient, and equitable. Equitable in the sense that everybody gets the same benefit package. And it's really important to know that with traditional Medicare, you can go to any doctor in the country, any hospital in the country who accepts Medicare, which is way over 95% of all doctors and hospitals, specialists, or primary care in the country. The key thing about what we call true Medicare or traditional Medicare is that, I guess, that big bunch of people on there on the left is the government or the taxpayers, because Medicare, when we get health care, Medicare pays our doctor. With traditional Medicare, our doctor or our hospital or the hospital bills the Center for Medicaid and Medicare Services, which is the government agency that runs traditional Medicare. And that agency pays directly to the doctor. Medicare Advantage gives us, if you have Medicare Advantage, Medicare, the CMS, the federal government, pays a capitation, like say $2,000 a year for your care. So they've got the money, and they decide whether, the way they make money is not pay your doctor or not pay the hospital, either just by stiffing them or delaying payment, or saying, no, you can't have that. That's something that we don't cover and we're not going to pay for because it doesn't meet our criteria. So you've got a middle person in between you and your doctor trying to get your doctor paid. And there's a lot more to this story. That's why we say Medicare Advantage is not real Medicare, because it blocks access to many physicians and hospitals, delays or denies, uses prior authorizations. And there's another thing, which is if you choose, so for those of you out there who are trying to decide what to do this year as you become Medicare eligible, know that if you are persuaded to be in a Medicare Advantage plan, when you sign up for Medicare and then you get your Medigap policy, they can't up your premium for your Medigap policy because of pre-existing conditions by law. But if you pick Medicare Advantage and you're in it for a year, and then you decide you want out, and you go back to traditional Medicare and you try to get a Medigap policy, then, except for in a few states, they can up your premium or even deny you coverage because of pre-existing conditions. So that's what it means here by being trapped in Medicare Advantage after 1 year. Harm is intrinsic to corporate profiteering, was our conclusion from this study. And these are some of the ways, and I've kind of touched on them already, and I want to keep moving, that Medicare, so we call it Medicare DisAdvantage, that Medicare DisAdvantage actually is harmful both to patients and physicians, and I say to our country, because we're paying, there are huge overpayments. And we have a whole separate report from last year about how that money game works. They use it as a cash cow. And part of that has to do with them having hundreds of millions of dollars in excess profit to pay lobbyists to lobby CMS and Congress about how they get paid. They've even documented the corporation saying it out loud that they don't care if it's harming people because the whole point is profit margin for shareholders, like so many other things. So CVS Health, which actually now owns Aetna, so we have one great big Fortune 500 company, which is CVS Aetna, and they're developing vertical monopolies, controlling everything: drugs, hospitals, doctors, insurance. But they, not surprisingly to us, value membership, margin over membership. And Tim Cowie, the CVS Health CFO, who probably takes in about $20 million a year. That's a typical corporate health insurance company CEO salary. He's CFO. That was saying CVS may cut MA benefits, just pulling out of unprofitable counties because the goal is margin over membership. If we lose up to 10% of our members, that's okay, because having access to health care and covering as many people as possible is not the goal. The goal is margin and shareholder value. There's an organization, a national organization called People's Action, that our sponsor tonight, Citizen Action, is actually is kind of the affiliate here in West Virginia. And they have a program called Care Over Cost. And they're pointing out that people are stuck with bills they can't pay. We've all heard this story before. You all know the stories. So people stay sick, injured, and sometimes die. And Care Over Cost has been helping to appeal denied claims. Many of the claims or the prior authorizations that are denied, actually with extra work will be approved, but the game is to put hurdles in people's way so they'll give up, get discouraged, and go away, and we, the company, keep that as profit. Now the Medicare Advantage companies claim that Medicare Advantage actually relieves inequities. And that's based on the fact that a higher percentage of low-income people and people of color are in Medicare Advantage. I talked recently to a physician in Puerto Rico, and he doing phone banking to try to get PNHP members. And he said, Medicare Advantage is really taken over here because many people are low income, and Medicare Advantage is what they can afford. Cost-related problems, accessing care by people in fair or poor health. If you have traditional real Medicare with a Medigap policy, about 25% of white people and 27% of Black people report cost-related problems if they're in fair or poor health. With Medicare Advantage, 35% of white people and 50% of Black people report those problems. So there are racial disparities built into Medicare Advantage for those who care about that, and I'm sure most of the people on this call do. This is interesting. In a metropolitan market, 42% of local physicians, so that would include primary care and specialists, 42% are not in the local MA network. In other words, if you have Medicare Advantage, you can't go to them. In rural areas, 65% are not in the MA network. So in West Virginia, sign up for a Medicare Advantage network. If you live outside a metropolitan area, and most of us do, you may find that 65% of the doctors in your area are not in your network. And that's a common problem all around the country with Medicare Advantage plans. The report says that we're being cheated by Medicare Advantage because when Congress actually allowed the private insurance companies into the Medicare market and Medicare business, it was as part of a competition is good philosophy that said if private companies can be offering Medicare plans, then that can save the government money. Kaiser Family Foundation has demonstrated again and again that Medicare Advantage has never saved Centers for Medicare and Medicaid Services, Medicare government, Medicare management has never saved them or us, the taxpayers, any money. They keep making more and more profit, costing us more and more, and yet they're so powerful with Congress and with Medicare itself that it's been hard to push that back. And there have been recent newspaper stories about that, that CMS actually realized what was going on, drafted policies to try to put it under control, and then the backlash from the big companies was so ferocious that they backed off. And by the way, I just want to say, remember in like 2010, when the Tea Party was going crazy about don't touch my Medicare, because the Obama administration in the Affordable Care Act budgeted less for Medicare Advantage plans because they realized this. So the Tea Party and eventually MAGA backlash about don't touch my Medicare had to do with trying to control the costs, the excess costs that private Medicare Advantage was causing for taxpayers. So the corporations aren't doing what they were supposed to do. Instead, they harm us. And the line here, we must protect the people in Medicare Advantage, but stop paying for things that are bad for us.
And Dr. Doyle, we're going to have to cut it off there so that we have time for questions at the end. We're already starting to get some questions in the chat, but I want to let Jenn speak. And then, if we can get through to the rest, we certainly will.